Hi, everyone. This is Madison Wall from the Tennessee Justice Center. We're going to get started in just a couple minutes. It's 11:01 right now, so I think we'll just give just a few more minutes to see if anybody else shows up. If you cannot hear me, please let me know in the chat box. I think everything's working all right, but feel free to let me know. Hi, everyone. If you can hear me all right, if you could just type yes in the chat box, that would be really helpful. Just trying to get things set up over here. We'll get started shortly. Hello, everyone. We are just about ready to get started. Just going to take one more minute. I see people still coming in, so let's just hold off for one more minute and then we'll get started. Thanks, everyone. Okay, good afternoon, everyone. My name is Madison Wall, and I'm a child nutrition advocate here at the Tennessee Justice Center. Today, I will be talking about the hunger landscape in Tennessee, school breakfast, and what you can do to support hunger-free communities. I should mention that this is the first webinar in a breakfast webinar series that will eventually cover more details about how to advocate for and eventually implement breakfast after the bell programs. So if you're interested in this content, but you're wondering, is she going to explain more, or what would the next steps be? Don't worry, we actually have a whole series planned, but we're just going to go through the introductions of it today. Before we get started, I just wanted to give a quick overview of TJC's services. So we provide life-changing services to individuals. So we help people get needed services through public programs that are supposed to provide medical care and support for vulnerable children and adults. These are programs like 10 Care and Choices, for example. So our clients include children suffering from chronic health conditions, mothers unable to access prenatal care, families struggling to get quality nursing home care for an elderly relative, and more. So in 2017, we assisted over 1,300 clients. We've got a staff of full-time advocates, lawyers, and volunteers, and we have a lot of areas of focus. I definitely cannot even cover how many different types of cases that we help people with, but some of the big ones are choices, ECF choices, we handle redeterminations, appeals, eligibility, Medicare savings programs, and SNAP eligibility as well. We also offer support to community partners. So we help healthcare workers, professionals, and volunteers understand and use complex laws to assist their vulnerable clients. And specifically with the child nutrition programs, we offer trainings on SNAP, WIC, and school meals, like the one that you're listening to right now. And finally, we identify the problems that prevent public programs from working as they should, and we use those insights to fix problems in a way that makes our healthcare and nutrition safety net fair and just for all. We have a couple of different campaigns to that end. We have a campaign to expand Medicaid. We have a campaign to make sure that every eligible child in Tennessee is enrolled in health insurance. And of course, we also have several nutrition and anti-hunger initiatives. And when it comes to our nutrition work, we really focus on SNAP, and we focus on 3 vulnerable populations. That's children and families, seniors, and unemployed workers. We actively work with DHS to ensure that the process is effective and that people are receiving the help that they qualify for. So we work with a lot of organizations, agencies, and institutions that serve children and seniors to make sure that they have up-to-date information about changes to program policies, and that they know, and I think maybe this is the most important part, and that community partners know when is a good time to refer clients or people in their communities, when is a good time to refer them to TJC. So what are the instances where TJC could potentially help someone? And finally, if you're interested in any of these other topics, which we really won't be going into today, please feel free to contact our trainings manager, Thomas Bynum. That's his email, but of course you can also email me as well, and I'll make sure to connect you. So all that aside, here's what we are actually going to be talking about today. We are going to be talking about child hunger, the school breakfast landscape. We're going to talk about how schools can improve and modernize their school breakfast programs. And finally, we're going to talk about what you can do to strengthen those programs and really start addressing the child hunger that we have in Tennessee. So it's a little sad at the beginning, but I think it's important that we kind of talk a little bit about the hunger landscape and get a sense for the scale of this issue. So America recently reached a tragic historic marker. More than half of children in public school now come from low-income families. And we really see that impact here in Tennessee as well. We see that 1 in 5 kids struggles with hunger in our state. The red counties are counties that have a child food insecurity rate above the national average. So all of those red counties have a child food insecurity rate that's between 17.9 and 29.3%, and that's all higher than the national average. So what that kind of shakes out to mean is that over 350,000 Tennessee children are food insecure. I mean, we really see the impact of this hunger on our children. 3 out of 4 public school teachers say that students are coming to school regularly hungry. We know that hungry children are sick more often, that they recover more slowly than children who aren't food insecure, and we also know that they're hospitalized more frequently. And I don't have a PhD in neuroscience, and I'm not a nutritionist, but I think that it's fairly intuitive to understand that food insecurity can have a really damaging impact on a child's developing brain. So now that we kind of know what we're working with across the state, I'm going to talk a little bit about how school breakfast acts as an agent against childhood hunger. So school breakfast, I'm not really going to spend a ton of time extolling the virtues of breakfast because I think that it's intuitive that breakfast is really important for young children with developing brains who need a lot of energy to make it through every school day. But this is just a very, very simple recap of the research. This research has been going on for decades and decades. It's very sound. And it also, is consistent across school populations. So basically what we see is that school breakfast is going to improve a child's cognitive function. It improves their attention and memory. It has an impact on attendance, and it also has a pretty strong impact on behavior. And besides kind of these anecdotal stories where you've got teachers saying, when my kids have breakfast, they're a lot more calm in the morning. They seem a lot, more ready to learn. And all of those anecdotal stories, I think, are super important. But also when we try to measure it, try to actually look at the changes in behavior of children, we can actually observe that there are fewer disciplinary referrals in the mornings in schools that serve school breakfast and in schools that really make serving breakfast a priority for their students, sometimes in the classroom. So we can see that not only does receiving a school breakfast help students' behavior and helps them focus, but it also has an impact on their achievement. So on average, students who eat school breakfast achieve 17.5% higher scores on standardized math tests, and they attend 1.5 more days of school per year. And all of this positive impact doesn't even really scratch the surface. It doesn't even capture the positive impact that I hear about from teachers and principals and even parents who are really passionate about their school's breakfast programs because they perceive it as being a big part of their school's culture. I've had teachers talk about how it's an important social emotional time for children, especially when they eat communally together in the classroom, and they're able to really sit down and enjoy that meal without the stress of going through the cafeteria line and without that stress of being worried about making it to class on time. So I think that school breakfast, while it may seem obvious that it would help with things like student achievement, I think that based off of the conversations that I've had with people and what I've read, that it actually has pretty far-reaching positive impacts on schools. Finally, school breakfast participation really promotes good health. Kids who eat school breakfast, there are fewer visits to the school nurse. It improves children's diets. It lowers the risk of childhood obesity, which of course is a pretty big concern in Tennessee. And it also supports lifelong eating habits. They've recently released a lot of studies showing that school breakfast participation is associated with lower BMI, and it's also associated with a lower probability of being overweight or obese. When I talk to folks that might be skeptical kind of about school breakfast and the impact it can have, I like to highlight the difference between participation versus non-participation. I think that teachers have a great perspective on this as well, and they often describe a stark difference between a classroom of kids that has been fed versus a class of students who have not been fed. So you can look into things like overall diet quality. And you can also see that kids that are eating school breakfast are less likely to have nutrient inadequacies, and they're also more likely to consume fruits and vegetables. So how is Tennessee doing on school breakfast? So we see that about half of students are eligible for free or reduced price meals. But of those eligible students, only 64 are eating breakfast for every 100 students that are getting that free and reduced price lunch. So in other words, the kids that are low income are a lot more likely to participate in school lunch than breakfast. So this is what I'm going to be referring to throughout the presentation when I talk about the breakfast gap. And according to kind of our calculations, there are currently 175,000 low-income kids in this breakfast gap. So they're not receiving school breakfast, although they are receiving school lunch. And I don't think that these numbers or these benchmarks are, the only way to measure success by any means, but I think it's kind of interesting to point out that if Tennessee as a state wanted to hit a national benchmark for participation, which is about 70%, I think, is the national benchmark for participating in school breakfast, then we would need to add about 26,000 more students in order to really hit that benchmark. So you can see that as a state, I think we do have a ways to go. Here's another look at the breakfast gap. So in this map, the lighter shaded counties, those are the counties that have high participation, and the darker that the county is shaded, the lower the participation is in school breakfast. Some counties have participation as low as 39%, while others are essentially at 100, so they're reaching almost every eligible child. Just going to give you a second. If you were checking out certain counties, you want to get a closer look. Okay. So now we're going to talk about what modernizing a school meal kind of looks like. And typically it entails changing the model of the program itself to make breakfast more accessible to more children. Many have found that serving breakfast after the official start of the school day, also known as serving breakfast after the bell, can dramatically increase participation. So when we're talking about modernizing programs, what I mean by that is that we're making the programs more accessible to more students by moving breakfast from the traditional cafeteria model before the official start of the school day to serving breakfast after the school day has begun. And I'm not going to spend a lot of time on this slide, but this is just a brief history of the National School Breakfast Program. I just like to call your attention to the bottom of this list. So you can see that the Healthy Hunger-Free Kids Act passed in 2010, and CEP, which is the Community Eligibility Provision, became available nationwide in 2013. And I'm about to explain in a lot more detail what this provision is, but what it essentially does is make it possible for high poverty school districts to serve school meals at no cost to all students, regardless of the individual student's income level. It's a program that allows all students to have school meals for free. And importantly, for the topic of this presentation, CEP also makes it easier to implement breakfast after the bell programs that increase breakfast participation. So here's a breakdown of some breakfast after the bell models that are really going to incorporate breakfast as a part of the school day. And I just want to say from the outset that these models are very customizable based on what schools think are going to work best for their students. So there's no one way to do breakfast after the bell correctly. These are just models that a lot of schools have found helpful, but many schools have also adapted these, to meet the needs of their students. So the first one is called breakfast in the classroom. And in this model, the food is usually delivered to classrooms from the cafeteria in coolers or in insulated bags, so that when students arrive, they put their things away in the classroom, they get settled in, they can just come into the classroom, grab their food, and actually eat it in the classroom. In the grab-and-go model, students can pick up packaged breakfast from mobile service carts and take the breakfast with them to class, where they can then eat in the classroom. I've seen this model be very flexible. I think it just depends on what the school would like to do. There are several schools in Tennessee that have a grab-and-go model, but they still have the students go pick up the food from the cafeteria line, but then students are allowed to then take it back to the classroom with them and still enjoy breakfast as a part of the school day. And then a third model is called Second Chance Breakfast, and this is a really great model for middle and high schools because often we know that older students don't want to eat breakfast very first thing in the morning. They're not biologically kind of attuned to be hungry and want food that early in the morning. And so what some schools have done is that they'll offer breakfast, maybe not in the classroom, it might even be in the cafeteria, but they'll offer it at a later time. And they'll make sure that it's a part of the school day by, making breakfast available between first and second period. It can also be served via grab and go. It all just depends on what the school schedule is and really what they think would work best for the most students. So I've talked a lot about how changing the model impacts participation. This is a breakdown of average participation by model type. So you might be wondering why breakfast after the bell seems to be reaching a lot more students. And really the main reasons is that there are several significant barriers to participation with the traditional cafeteria model, right? So one of the major issues with just serving, breakfast in the cafeteria, which is what I had when I was in school and maybe what you had when you were back in school, but if it's served too early, then students really aren't going to get the chance to access it. It might be too early because parents can't drop their children off at that time, or breakfast may be served even too early for the buses to make it in time for students to go through the line and actually eat. and get to class on time. Furthermore, I already mentioned this, but it might also be served too early for older students who aren't going to be hungry at that hour. Finally, school breakfast in the cafeteria, that in some cases can compete with really valuable social time. Many students, when they first get to school, that might be one of the only opportunities that they have to catch up with friends. And if eating in the cafeteria, is far away from everyone and where everyone is congregating, then that can introduce this element of social competition where students really want to maximize that time with their peers. And eating, breakfast alone in the cafeteria so early may not be very appealing. And finally, many students don't want to be singled out as poor. I think, we know that the stigma of eating what other students might know is a free or reduced price meal can be really painful for students, and they will go to great lengths to avoid it. In other words, we know that students who are hungry, who want to eat school breakfast, sometimes they simply don't, and that's because they feel isolated and because they feel a stigma around that meal. But conversely, you can see with the breakfast in the classroom model, you're hitting 88% participation. On average, oftentimes it's much higher than that. Second chance breakfast is kind of coming in second place at 70%, and then grab and go is at 64%. So basically, all of these models could potentially be a great choice for our school that's still going to reach more students than the traditional model would. Okay, so now we are going to shift a little bit, and I'm just going to talk about how Breakfast After the Bell programs work with CEP, which, as I mentioned before, that's the community eligibility provision. So I'm going to cover what criteria are considered for schools to become CEP schools that offer meals to all students at no cost. And it's going to seem like I'm diverging here and like the slide does not belong, but just stick with me, folks. I promise that this will be relevant in just a few minutes. So about 40% of SNAP participants in our state are children. And SNAP is the Supplemental Nutrition Assistance Program, formerly known as the Food Stamp Program. And it's a federal assistance program for low-income individuals and families. So this is just a map of Tennessee, and the darker the shade, the more kids that are on SNAP in that county. And in some of these counties that are shaded, this very dark shade, that's indicating that between 1 and 3, or, half of all the kids in that county are on SNAP. Those are pretty big numbers. And by the way, this data is coming from the Tennessee Commission on Children and Youth via their Kids Count data project. And this particular project has a lot more information about child kind of welfare and health, and they have data for every county in the state. So if you're unfamiliar with the Commission, I highly encourage you to check out their other data resources because they are very good. So basically with this slide, we just want to establish that the need is pretty high and that a fair amount of students in Tennessee are on SNAP. Okay, now let's dig back into CEP, knowing what we know now. So here is why the number of kids enrolled in SNAP is related to school meals. Just direct certification. Okay, so in the process of direct certification, children are going to be certified for free meals without submitting a school meal application. And this is going to include children who are directly certified through data matching for free meals because they live in households that are participating in SNAP and Families First. I just want to give a second to absorb because it's kind of a lot. So basically, a directly certified child is enrolled in free meals automatically because they are a child that is already participating in SNAP or TANF. But other students can also be directly certified without an application, and these are students that are just falling into these certain categories. So these are kids in foster care, Head Start, these are your homeless students, your runaways, or your migrant students. So all of these students, because we already have data about them and because they've already gone through the process of being means tested and then being enrolled in these programs, we already know that they're low income. And so this is information that we can use to automatically enroll them in free meals without their parent having to fill out an individual form specifically for school meals and get that form back to the schools to be processed. So here are the differences between how students were kind of previously identified for free or reduced price meals versus this new system that's using direct certification. So in the traditional model, you have districts that are identifying low-income students through those applications and through direct certification. But in this system, low-income students are the only ones who have access to the free or reduced price meals, and the other students have to pay full price. Under the community eligibility provision, the low-income students are still going to be identified through the direct certification process, and districts can offer district-wide through a group of schools or even through individual schools. They can offer this provision as long as they have 40% low-income students. And schools are going to be reimbursed, federally reimbursed for their meal programs based on what that proportion of low-income students is. And then every 4 years, a district must update those numbers of how many students are directly certified. But don't worry, I'm gonna go over this stuff again because it does seem a little bit complicated, and I think that that's because it is, and it was a pretty big change for schools and for districts, but ultimately it's a lot less paperwork for districts to go through. So the reimbursements are calculated by multiplying the percentage of those directly certified students by 1.6, and that's going to give you, your percentage of students. And the reason why they use that 1.6 multiplier is just to kind of capture any other students that they may have missed, right? So if a school was only, taking into account the students that they knew were enrolled in SNAP, enrolled in TANF, and then they were counting, the foster kids and the migrant children that they knew of, that 1.6 multiplier really is just there as kind of the safety mechanism to make sure that, if the school missed something, if we didn't count every single low-income child correctly, then we're making sure that we're covering our bases. Because remember, with CEP, they're no longer sending home those free and reduced price meal forms anymore. Everything is done through data that the state already has. That's why they use a 1.6 multiplier. So this is just showing the reimbursement kind of formula in action. So for example, a school that had 50% identified students would be reimbursed for 80% of the breakfast and lunches served at the free reimbursement rate, 80% paid by the federal government, and then the remaining 20% the schools would have to pay for at the regular paid rate. Okay, so this, in order to participate in CEP, a school has to have at least a 40% direct certification percentage. That's the minimum to participate. But it is not uncommon to see schools that have really high rates, 60, all the way up to 65%. And if a school has a 65% percentage, then that means that all of their students' meals are paid for free by the federal government, right? So that's a very powerful tool for school districts. So I touched on these a little bit, but I just wanted to be clear about kind of what we're talking about and why it's important. So CEP eliminates the unpaid meal fees. So when all children eat at no charge, the school district doesn't have to collect unpaid meal fees from families. It increases participation. So when schools are able to offer breakfast at no cost to everyone, you just see huge jumps in participation, and this is observed, nationally as a trend. It also improves the financial viability of school nutrition programs. When participation does increase, then school districts can take advantage of economies of scale, and then they can reinvest additional revenue to improve nutrition quality and provide staff training. They can basically save a lot of money as long as they have strong programs that have good participation rates. It also lessens the administrative burden. So schools no longer have to collect and verify school meal applications, and they can really focus on what they do best and what they care about, which is feeding children. Not getting second paperwork, but feeding children. That's what it is all about. And finally, having CEP facilitates the implementation of breakfast after the bell models, right? So when schools don't have to collect fees, or when they don't have to count every single meal that's served by fee category, it simplifies serving breakfast after the bell, and then that can make participation boost even further, right? So it is possible, I suppose I should say, it is possible for schools to have breakfast after the bell models and not be a CEP school. But I would say that that's fairly rare, just because administering that program would be a little bit difficult. It's kind of hard to serve breakfast in the classroom, for example, and still be charging some students some rates and other students other rates, and some students are eating for free. That's really the type of thing that is typically handled at the point of service machines in the cafeteria. So I would say that schools that have CEP are really great candidates for breakfast after the bell programs. So this is kind of the state of CEP schools in Tennessee right now. It's reaching, 428,000 students. We've got about 77% of CEP eligible schools that are participating, which is a good number, but of course we would ideally want all of those schools that are eligible or near eligible to be participating. And when we see the schools that have high numbers of low-income students, we see that 92% of those that are qualifying for a full or near full reimbursement are participating, which seems like a high number, and it is, because Tennessee is a leader in CEP adoption nationally. We really are. We're doing a good job. It's just there are obviously more schools that could be taking advantage of this critical program, and they could be leveraging a lot more money for their district, and of course feeding more children. So I'm not going to spend a ton of time on this, but essentially if schools were leveraging, for every 5,000 additional students that eat breakfast in Tennessee, that would translate into an additional $1.4 million in annual federal child nutrition funding. So this is for the whole state of Tennessee. If we added 5,000 more breakfast eaters, that's how much additional money would be coming into the state. And then if you break it down even further, this is a bit of a random example, so I'm not calling out Robertson County by any means, but here you see that if 600 more students were eating in Robertson County, then that would translate into $180,000 in annual federal child nutrition funding. At this point, I also just want to take a minute to highlight the connection between SNAP-enrolled students, so those are our directly certified students, and state education funding, okay? And state education funding is often kind of referred to as BEP funding. I'm not going to throw all these acronyms at you, but in case you had heard the term BEP funding, that's the Tennessee state education funding, and that's kind of what we're talking about right now. So in 2016, Tennessee basically changed the definition of an at-risk student, and they changed it to mean a directly certified student. And they changed the funding formula so that districts are receiving $863.25 per directly certified student, right? And this is state education funding. So I'm not talking about like title funding or federal funding. This is just money that goes into school districts for directly certified students. So I think that hopefully this demonstrates kind of that SNAP enrollment really matters, both for school meals, because when there are more directly certified students, then schools can qualify for the free meals. But SNAP enrollment is also really important for kind of our general education funding. And it continues to be really important, and I'm not going to linger on this, but I just wanted to point out that there have been significant decreases in child SNAP participation from 2013 to 2016, and this actually continues, of course, all the way until present day. We've seen pretty big declines in SNAP participation, which is due to our improving economy and probably a lot of other factors, but I just point this out to say that as SNAP enrollment declines, it's becoming even more important for districts to conduct SNAP outreach and make sure that all eligible families and students are getting the nutrition assistance they need. This is just a CEP timeline. These are just some deadlines that the districts adhere to that are really useful for child advocates just to be aware of. So that April 15 is when the school level CEP eligibility data is provided to state agencies. And then May 1st is the date that data goes public. And that's information that you can access at any time. So the most recent data, just like every year, will be available on May 1st. And then June 30th is the deadline for districts to notify the state agency of their intent to start CEP if they're not already CEP. Okay, so these are the kind of internal deadlines that the district is working with. Okay. Whew. Just taking a small breath here. I feel like just been over so much, and it does get a little bit technical, so thank you for just bearing with me as we kind of are explaining CEP and how it's relating to students. You'll see really shortly at the end of this presentation, I've provided some resources for you to kind of refresh yourself on this program, and definitely feel free to do that if this is something that you're interested in. But essentially, these are TJC's suggestions for steps that you can take to really fight child hunger by leveraging these programs that already exist. So we encourage you to check the numbers for your district. And these numbers will be available on May 1st, but you can still go online and check your current numbers right now. We encourage you to reach out to your districts and encourage them to participate if they're not participating, especially if they are eligible for CEP. They would be a great candidate for modernizing their school breakfast program. I think that it's really important that people in the community are promoting breakfast after the bell models in places that already have CEP. I know that already seems a little bit strange, but it is happening. So in other words, there are schools in Tennessee that are CEP schools where all kids eat breakfast and lunch for free every day. However, those schools, just because they have CEP, doesn't necessarily mean that they went ahead and modernized their school breakfast programs, right? And those are really the schools that are the absolute easiest target for child advocates, because they already have the tools to do a breakfast after the bell program, but they may need additional resources or they may need additional support to really make that change. And that's absolutely where you can come in. We also would encourage you to kind of help your school district connect eligible families to SNAP. This is kind of why I diverged for a few minutes and started talking about the connection between SNAP and the direct certification levels, and the connection between SNAP and that state education funding, so that you won't think that I'm just asking you to go support SNAP, because that's what TJC would love everyone to do, but it's really important that districts kind of understand the relationship between conducting good SNAP outreach and getting high and accurate numbers versus not conducting SNAP outreach, because that can have really big implications for their funding. It can have implications for a lot of children and families who are depending on these programs. Finally, we have a peer-to-peer network of breakfast champions. Breakfast champions are parents, teachers, principals, school nutrition directors, and other anti-hunger advocates. These are folks that usually have firsthand experience with breakfast after the bell programs. So these are folks that know a lot about how these programs work and how powerful their impact has been. They're really the network that we talk to when we're trying to get the best practices for these programs. And if this is something that you're interested in, definitely do not take my word for it that these programs really help students and families. We are happy to connect anybody who's interested to somebody who really has that firsthand knowledge of running these programs in the schools themselves. And right now, the membership of kind of our peer-to-peer network is around 25 individuals. So we would love to expand that. We would love for people from all over the state and from elementary, middle, and high school concentrations to join and just make it as diverse of a network as possible. Other things you can do, you can follow us for policy updates and for technical assistance. So if you ever have questions about how the program works or doesn't work, or if you've read something in your paper about, you know, your district is going to offer CEP, but now it doesn't, or it could, but it might, and you're just like, what is going on in this county where sometimes students eat for free and other times they don't eat for free? Well, that's something that we're happy to help you understand, and something that we'd love to support you if you want to go in and talk to people about what's happening and promote CEP and kind of explain what are steps that schools could be taking to feed more kids. Another thing is that I mentioned this at the very beginning, but this is actually the first webinar in a series of webinars. So if you want to know more information and really get into kind of the nitty-gritty of, you know, what are the best practices, what are the best ways for advocates to promote these types of programs, and, you know, what are the steps that schools need to take in order to start these programs, that's all information that we are going to cover in future webinars. And I think that this is fairly self-evident, but also we're happy to provide talking points about CEP to help you facilitate conversations with folks at your district or your school board. I would personally recommend connecting with your folks at Coordinated School Health. connecting with your local child welfare council, or other active child advocacy or parent groups. And kind of my last thing, I know that the very first point right here, check the numbers for your district, your CEP numbers, which you absolutely can do. But I also just want to point out that if you want to dig even deeper into data, like your local data, whether it be at the school level or a group of schools, we actually have that individual school breakfast participation data. And feel free to just shoot me an email. I will put that together for you and send it to you in an Excel so you can kind of see what the status is, broken down even further at the school level. I mean, especially if you have children in particular schools and you'd like to check that information out, that's absolutely something that we can help you with. And finally, these are just some resources that I've mentioned throughout the presentation that I think are really helpful for just understanding CEP and how it works. This is the database of eligible and participating schools. The Tennessee Department of Education also has some great resources and also publishes the CEP eligible and participating schools. And then down here, we also, I linked the site for the Tennessee Commission on Children and Youth. And so if you're interested in learning more about really just child health and child welfare in general, but you're looking for county-specific data, this is a great resource for you to check out. And this entire presentation will be emailed to you, so don't worry about not having access to these resources because we will follow up with them. And this is my contact information. If you don't already have it, feel free to email me about anything that I talked about today, or if you have any questions or data requests. Also, if you have any immediate questions, feel free to put those in the chat box. I will hang around for probably just a minute or two to see if anything pops up in the chat box, but if it doesn't, thanks so much for joining me today. I hope that you learned something, and I hope that you join us on future webinars. Thanks so much.